Migraine is a common ailment. It comes from two words, hemigrania, half-sided headaches. All migraines are headaches, not all headaches are migraine. Migraine has some special symptoms. It will be associated with nausea or vomiting, sort of acid reflux, photosensitivity, sensitivity to sound. You don't want to be touched, you want to be left alone, and it always lasts for 2 or 3 days. It's like a flu. If you get it, it'll last for 7 days. Now, migraine also is very, very cyclical. It'll either happen once a month or once in 2 months. So therefore, you know when the headaches are going to come in. So there's a lot you can do about it. So 1 week before the expected date, then you start taking precautions. You change your diet. One of the things that you have to make sure that you do is to find out that this is a migraine. There are ways of establishing that. First of all, you try and sort of see if there is sensitivity in the TMJ, Temporomandibular joint, which is located, the jaw joint, which is located right in front of the earlobe. And this joint often becomes the epicenter. When you're very stressed, you grind your teeth, you're tensed, then this joint becomes very sore. So the tension, the pain actually spreads from here to half the headache. The other area that you can examine is your neck. You see, there's a pair of arteries called the vertebral arteries, which are located inside the cervical spine. So when there's any disalignment of the cervical spine due to a trauma, injury, or even sort of birth injuries, then as soon as the muscles get very tight, that area gets pushed. So as a result, what happens? The blood flow to the brain gets obstructed, and you get this turbulence. Boom, boom, boom. You get these headaches behind the earlobes. So if you place your fingers just on the occiput on one side and try and sort of push down, going down to the top of the shoulder, you'll find one spot or two which is very, very sensitive. As soon as you touch this spot, you might get a sensation of pain behind the eyeball or in the temples. So that shows that that is the trigger point. From there, the headaches start. So massaging this area, the TMJ and the neck area, is very, very important. This is one of the main therapeutic treatment. But the diet is very important. So 1 week before the expected date of the headaches, migraine attacks, you can avoid eating nuts, because the more you chew, the more the joints will hurt. You can avoid citric fruits, which causes a lot of acid, sour fruits like pineapple, mangoes and kiwis. Then you can avoid spicy food because it produces a lot of acid. The more acid you have, the more nausea you feel, the more you want to throw up. Then you have to avoid things like yeast products, fizzy drinks, alcohol, coffee, salt. These agitate the body. So yeast products, they brew alcohol in the gut. And so you have to avoid all these things. Plus, you can do sort of partner massage, ask somebody to massage the neck and shoulder in those areas that I have shown, and also do certain exercises. From yoga, you can do several exercises for the neck, the head rolls, the cobra pose and the other poses that are shown in my various DVDs. And also you can do the breathing exercises. See, when you have the attack, the retention breath is fantastic, because if you sort of breathe in for 3 to 6 seconds, hold your breath for 6 seconds, and then exhale for 12 seconds or so, you'll be retaining carbon dioxide. The more carbon dioxide you retain in blood, the more you're going to exchange that for oxygen. Oxygen supply to the brain is very important. That's why the blood supply is so important. Sometimes migraine, when it's very severe, is treated by oxygen. You inhale oxygen, it releases that headache. So therefore, the retention breath is very, very important. And remember that you can prevent by following a lifestyle program, which is very important. Irritable bowel syndrome is a syndrome. It's not a disease. It's a collection of symptoms: constipation, gas, bloating, belching, diarrhea, abdominal cramps, all sorts of food cravings. Everything is put in one basket. And that's what irritable bowel syndrome is. Now, nobody really knows the causes. In my opinion, there are a few causes, definite causes. Digestion takes place either in the acid medium in the stomach or in the alkaline medium in the intestines. So there has to be a perfect balance between the acid and the alkali, because the alkali is created by bile and the intestinal juices. Now, if you eat too much of acid, or you're eating very fast, or eating a lot of nuts and rough food, the stomach has to churn the food a lot. The more it churns, the more acid it produces. So this excess acid has to be neutralized before the alkaline digestion can take place. And that is where the problem starts. If the acid mass cannot be evacuated into intestines, food remains in the stomach for a long time, causing indigestion and discomfort and all sorts of things. And then when enough bile is secreted, the food goes into the intestines, it mixes with the alkaline medium and causes a lot of gas. So you get a lot of gas from the chemical reaction. Yeast is another common cause of gas. Now, yeast produces beer, as you know. You use yeast to produce beer. Now, when you have too much of yeast or fungal things, like as in bread, naan, pita bread, beer, and if you eat too much of sugar, then you feed the yeast, then there's a lot of gut fermentation taking place in the gut. As a result of that, gas is released, and this can cause abdominal cramps. It can cause all sorts of discomfort. On top of that, the diarrhea, to lean forward and twist the wood, you'll have a bulge in the disc, in the bulge in the hot water bottle. Now, that's what you drink less orange juice and lemon juice and pineapple juice and all these acid juices. Make sure that you don't have too much of pickles, chilies. They are very acidic as well. Coffee, they tense muscles up. So you've got to avoid that. Calcium is very important. So you must make sure there's plenty of calcium through yogurt, milk, and cottage cheese. Then you've got to also make sure that you drink enough water. If you're dehydrated, the muscles are going to be in spasm. Moreover, the kidneys are embedded in the lumbar spine. So when the dehydrated kidneys become very sore, that makes the back muscles very sore. And if the lumbar muscles are sore, the low back is going to hurt. So you must try and prevent this. And of course, needless to say, you got to keep your weight under control. So by eating slowly, drinking less acid juice, avoiding yeast, avoiding alcohol, which is very important for weight gain, and then doing some exercises, general exercises, walking, jogging, or swimming, or even some gym exercises to make sure the weight is kept under control. Backache can be quite debilitating. Once you have a backache, you're going to always have a backache unless you change your lifestyle. You do these exercises, and with that you can prevent it. So next time you have backache, make sure you change your lifestyle and look at the website drali.com. For sore throat, make sure you drink hot water only and plenty of this cold relief tea. Massage the throat area with peppermint balm, which will soothe the throat. Massage the sinus point like this, and put 2 drops of sinus oil in each nostril, morning and evening. All this you'll find in the website drali.com.